tell me that I'm crazy, that there's nothing wrong with me.
They would tell her that she needed to go see a psychiatrist.
She was so close to death. She's seen that door.
She hemorrhaged. I never saw so much blood.
We just couldn't be intimate together.
I had the worst stabbing sensation. It was just so excruciating.
Next, two medical mysteries that defied the experts. Mary Ann Piazza is a healthy college student looking forward to a bright future until a seemingly ordinary cough begins to turn her life into a living nightmare.
There were times when I wished that I was dead because I knew, well, if I'm dead, I'll feel better.
Then, after more than 70 doctors dismiss Jennifer Martin Bray's chronic and debilitating symptoms, she begins to wonder if she'll ever be able to live a normal life again.
I just felt deep down inside that there was something really wrong with me.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In the spring of 2001, Mary Ann Piazza was a lively 20-year-old, juggling a very hectic schedule. When she wasn't studying for her degree in early childhood education, she was working at a local daycare center in Helena, Alabama.
I love my job because I was able to work with 2- and 3-year-olds, which at that time was my passion. You know, I had tests to study for, homework to do, just going back and forth to work and school.
She was always on the go. She was full of energy.
Her two sisters know firsthand. In fact, all 3 girls live at home with their parents. So when a nagging cough begins slowing Mary Ann down, her close-knit family takes notice.
She would have the cough from the time she woke up in the morning and until the time she went to bed. It never really went away.
I could feel it sort of in my lungs, and it was like a constant cough. And I thought at the time that it was just a cold, but it lingered longer than I thought that it should.
Determined to kick the cough, she visits the family doctor, who suspects she has a mild chest infection brought on by a seasonal cold.
I was prescribed antibiotics, and I took those, and the cough seemed to subside and go away.
By the time summer rolls around, Mary Ann is feeling like her old self, filling her days with work and school. Then, when she least expects it, she meets someone who will change her life.
When I first met Mark, I could tell that there was really something there. It was just kind of maybe love at first sight, I guess you could say.
One of the things that jumped out at me when I first saw her was her smile. Her smile just brightens up a room, and her eyes, they give away whatever she's feeling.
Mary Ann and Mark quickly become inseparable. But the irritating cough she had 8 months earlier suddenly returns with a vengeance.
The cough became worse. Normally when I would get sick, I would bounce back quickly, so it concerned me.
Alarmed, she checks back in with her doctor, who, once again, promises her that her seemingly ordinary cough is nothing to worry about. But as summer turns to fall, her hacking cough hasn't let up, and a foreboding new symptom begins to emerge.
I was starting to experience more fatigue. I was getting very tired.
She would come home early and lay on the couch because she didn't feel well, and it seemed very strange for her to be acting that way.
The lack of energy concerned me because here's a woman in her lower 20s. She shouldn't be having energy problems. I mean, she should be, up and moving around, bouncing around.
Growing more and more concerned, Mark convinces Mary Ann to make one more appointment with her doctor. This time, he orders a chest x-ray. And when the results are in, it's clear that Mary Ann has more than a run-of-the-mill cough. There's a small shadow on her right lung.
He explained that the spot there was what a doctor would normally see from pneumonia.
The shadow indicates that there's some fluid accumulating in Mary Ann's lung, a common sign of pneumonia. But he reassures Mary Ann that with a course of antibiotics and a daily steroid inhaler, she should bounce back within a week.
I was pacified. I was like, okay, well, we know what it is. I've got medicine for it. I was just going to take the week off from school and work to recuperate.
She follows the doctor's orders, and in a few days, Mary Ann is starting to feel a little better. But 2 weeks later, her cough returns, worse than ever.
The cough, didn't go away like I thought it would. So I was given more of the same treatment.
Over the next 2 months, Mary Ann finds it harder and harder to get to class on time. She's completely drained. But Mark is becoming her cornerstone, the one person she can count on no matter what. By December, she has no doubt that he feels the same.
He proposed on December 1st of 2001 in the same spot that he told me that he loved me for the first time.
About the time she realized that my head was actually losing altitude as I was trying to do the kneel thing, she freaked out.
Bless his heart, he was on one knee and the ground was cold, and he said, "Are you going to answer me?"
And she said yes, and that was it.
Soon after, Mary Ann makes another big decision, to quit her job and enroll in school full-time. But it soon becomes clear that her bouts of fatigue are growing more pronounced by the day.
It was taking me longer to get ready in the morning. I was oversleeping a little bit. Normally, I would just wake up and I was just ready to go immediately. So it wasn't like me to feel bogged down.
Mary Ann stays in regular contact with her doctor, but to her dismay, he repeatedly dismisses her troubling symptoms as the lingering effects of a generic chest infection.
I would call my doctor a lot, just simply saying, "I'm ready to get rid of the cough. It's affecting my life completely at this point." I started to think, well, maybe I'll never feel quote-unquote normal again.
In the summer of 1985, Jennifer Martin was leading a seemingly ordinary life in a small New Jersey town and gearing up for her first year in junior high.
I'd had a pretty happy childhood. I love softball and I used to cheerlead.
She was a happy-go-lucky little thing. She had a lot of school friends.
As her friends start going through puberty that year, Jennifer anxiously waits for her body to begin transforming as well. But she has no idea how dramatically her life is about to change.
Everything was fine until puberty, when she got her period. That's when everything went haywire.
When I turned 13 is when I had my first period. In health class, they talk to you about how it's going to be, and when I got it, it was nothing like what they described in school.
She got her period, she hemorrhaged. I mean, I never saw so much blood. Oh my goodness.
In a state of panic, her mother, Virginia Martin, rushes Jennifer to the ER.
They gave her a sonogram of her stomach and her ovaries.
I was filling a supersized pad 1 an hour.
And they said there was nothing wrong. She was a healthy 13-year-old.
The doctor assures them that Jennifer's body just needs time to adjust and that her period will regulate itself as the months go on. But a year later, she's still suffering from extremely heavy bleeding and severe cramping every month.
When I did have my period, I'd wake up to blood-soaked sheets. The bleeding is so heavy, I would bleed through my clothing at school. If I went out, we would have to stop every hour on the hour so that I could find a restroom because it was as if I was hemorrhaging. So basically, almost 2 weeks out of the month, I couldn't do anything.
Then, shortly after starting high school, Jennifer's periods rise to a whole new level when she begins experiencing incapacitating cramps.
Jennifer would lay on the couch, moan and groan. "Ma, it hurts, it hurts. I don't know what's going on. Help me, help me."
To make matters even worse, Jennifer is beginning to feel nauseated 24 hours a day, 7 days a week.
Everything in my stomach felt like it was coming up and sitting right in my throat. I basically would take a bottle of Pepto-Bismol with me everywhere I went.
I mean, there had to be something wrong. We were so frustrated. She was so miserable.
Feeling helpless, Jennifer's mother starts taking her to doctor after doctor, looking for any clue as to what might be causing the bizarre symptoms.
We went to many doctors in a period of 4 years.
But every expert assures Mrs. Martin that her daughter is a healthy, normal teenager and focuses only on treating the symptoms.
Basically, all the physicians that I did go to would give me pain medication. I tried everything. I tried over-the-counter medications, I tried holistic medications, and just nothing was working.
Eventually, the harsh reality sets in. Jennifer is simply going to have to live with the dreadful symptoms.
You know, I just thought, well, maybe this is just me and this is what I'm supposed to be going through. It's just a family thing.
I blame myself. You know, why did I put her on this earth? Why does she have to suffer the way she's suffering? It wasn't fair. It wasn't fair.
For more than a year now, 21-year-old college student Mary Ann Piazza has been struggling with a chronic cough that is beginning to take over her life. She's so fatigued that even getting out of bed every morning has become an enormous challenge.
It was almost like her body was telling her there's something very, very wrong. But yet she had doctors telling her that it's nothing huge.
She's been to see the family doctor more than 8 times. But each time, he's assured her that the symptoms will go away. They're just the remnants of a chest infection she had 7 months earlier.
I began to get frustrated when I didn't feel like I was getting any real solid answers. It's just, you're overwhelmed with school, it's just too much stress.
But when a number of alarming new symptoms begin to emerge, Mary Ann is certain that there is something seriously wrong with her.
I was starting to feel like out of breath, just doing normal activities with walking, climbing stairs, was a challenge.
She's never experienced anything like it before. Just a year earlier, she'd been the epitome of good health, and suddenly, daily activities have become a struggle. Then, as the months pass, she can't help but notice another unmistakable sign that her body is changing right before her eyes.
My sister was engaged and her wedding was approaching. We all got fitted for our bridesmaids' dresses, and then when the gowns came in, I could tell, well, it's too big, but I just got sized for it. It was kind of odd that I would just lose weight for no reason.
She was initially happy about it because she was thinking, great, I can wear these cute little things I've always wanted to wear, but the weight loss never stopped. And it reached a point where she started getting worried about it.
My pants weren't staying up, my shirts were getting too big. I would even start to avoid mirrors.
2 months later, Mary Ann has lost almost 10 pounds without trying, leaving her feeling like she's wasting away. But she could never have imagined the bizarre symptom that would rear its head next.
I remember one night I woke up just completely soaking wet. My pajamas were wet, even the bed linens were wet.
She would even call me at my house and say, Mark, just talk to me until I get back to sleep. I just woke up and I'm soaking wet. It's like I've been swimming.
It seemed like just one more problem that I was having. The shortness of breath, the wheezing, the fatigue, the weight loss, the cough. I now had night sweats.
I would answer the phone and I would try to take her mind off it, get her mind into a good place where she could kind of doze off on a happy note and not an I'm scared note.
It persisted every night. Then it progressed to itchy skin.
It was just uncontrollable itching to the point where she'd get up in the morning and there would just be giant track marks down her legs. She would just do it in her sleep.
Mark would always tuck me in before he would go home for the night, and he would kind of start this little routine of putting socks on my hands so that if I scratched my legs that I wouldn't hopefully make my legs bleed, but I would always take the socks off my hands during the night.
We weren't going to do something like duct tape it on, although we did joke about it.
It was just a series of making accommodations for all the things that were going on in my life.
By December 2002, more than a year after her family doctor diagnosed a simple case of pneumonia, Marianne has hit rock bottom. Now desperate for answers, she goes back to him, convinced that these new symptoms will be the clues he needs to finally put the pieces of the puzzle together.
I've approached my doctor with the weight loss, with the night sweats, with the fatigue.
This time he appears to be more attentive and performs a thorough top-to-bottom exam. But nothing could have prepared her for his shocking diagnosis. The doctor, who has treated Marianne since she was 15 years old, believes that she's anorexic.
When I got that answer from him about being anorexic, it was more than just frustration. It was almost more of an anger. It was, why is it that I can come to you several times with the same symptoms and they're getting worse? However, I'm not getting anywhere. I'm just being passed off and ignored.
Angry and insulted, Marianne realizes that she's reached her breaking point. She needs to see another doctor. This time, she makes an appointment with an asthma specialist, hoping she'll be able to figure out what's going on once and for all.
In the back of my mind, I would always say, well, today is the day. Today, this is all going to make sense. I'm going to know what's going on. I'm going to understand it, and it's going to go away.
As soon as she arrives at the new doctor's office, the nurses begin walking her through a series of tests.
I had to blow out with the same breath for 6 seconds, and I wasn't able to do that. And I can remember the nurses beating on my back, you know, telling me, keep blowing, keep blowing.
It was almost like they were bullying because, you know, she's thinking, I can't do this, leave me alone.
The nurses would say I was showing a poor effort, that I wasn't trying, but I knew that I was.
Within just 30 minutes of arriving, she's starting to get that familiar sinking feeling that once again, no one is taking her debilitating symptoms seriously. And when the doctor reviews her test results, she drops yet another bombshell.
I'm failing a pulmonary function test, but she referred me to a psychiatrist, thinking that all of my problems, all of my symptoms, everything that I had come to her with was mental.
For the past 3 years, 23-year-old Marianne Piazza has endured a mysterious constellation of relentless symptoms. A chronic cough, incapacitating fatigue, and night sweats like she's never experienced before.
I was at my lowest point. I was so weak, I wasn't able to open doors. I felt like I really couldn't do anything. Anytime I needed to do something that I really had to do, I would say, please God, help me, you know, get me through this.
Marianne has gone from a size 8 to a size 4. She can barely breathe going upstairs, and she's so lethargic that just walking to class at the local college is almost more than she can handle.
She was getting to class and she was having a hard time concentrating because she was so tired from the walk from the car.
And no doctor seems to be taking her very seriously.
Everybody's telling me that I'm crazy, that there's nothing wrong with me. No one is listening.
She would go to the doctor and, you know, they would tell her that there was nothing wrong, that she needed to go see a psychiatrist.
What's worse is that even her family is starting to doubt that she's sick.
The doctors I had gone to were explaining that I can't find anything significantly wrong with you. So my family just thought, well, you know, are you just doing this for attention? Why are you acting this way?
I was starting to wonder if she was just really depressed.
There were times when I wished that I was dead, because I knew, well, if I'm dead, obviously I can't feel this way anymore, and I'll feel better.
But Marianne refuses to let her agonizing symptoms break her spirit. In May 2003, 3 years after she first became sick, she decides to try one last doctor, internist Dr. Amy Lejeune.
My nurse called me aside and said that she'd got a call from a patient who was complaining of shortness of breath, maybe a little anxious, maybe having some panic attack type symptoms. It was a busy day. My schedule was full, so I said, sorry, we're full today.
But this time, Marianne won't take no for an answer.
They said, this patient that called that was short of breath, she's at the window now. She wants to be seen. I thought, you know, that doesn't happen very often, and so it struck me that she was that persistent. Maybe I should change my mind.
Dr. Lejeune instructs her nurse to begin taking Marianne's vitals and find out what she can about her medical history.
The nurse took my temperature and asked, why are you here today? And I went through all of my symptoms.
She told me that Marianne was a young girl who had been having some problems with breathing, and maybe she was stressed and having anxiety attacks. And as I was hearing all this information, I was glancing down at the chart, and I noticed that she had a fever.
A fever is often the body's way of fighting off an infection. It's a crucial clue that Dr. Lejeune cannot ignore.
And I said, wait a second, what about this fever? Did you ask her what could be going on there? And she said, oh no, I didn't, and I said, well, we need to find out about that.
The nurse immediately orders a full blood workup, a urine test, and, for the first time since her diagnosis of pneumonia 2.5 years earlier, a chest x-ray. But no one is prepared for what it is about to reveal.
Our radiology technician did the x-ray, and she came and she said, you've got to look at this. Essentially, the entire right lung was opacified. It's supposed to look dark, which is the appearance of air on a film, but it was white. It was not a good-looking x-ray.
Dr. Lejeune takes a deep breath before sharing the ominous news with her new patient.
At that point, I had not even met Marianne yet, so I went in and introduced myself and said, I understand that you've been having some symptoms that are worrying you, and I can tell you that there is good reason for that worry. There is definitely something wrong. There's something in your chest, and we've got to find out soon what that is.
She put the films up on the screen, and she showed us the shadow, and she said, this is not supposed to be there.
Over the past 20 years, more than 70 doctors have examined Jennifer Bray, and not one of them has been able to identify what's causing her excessive monthly bleeding, debilitating cramps, and constant nausea. But now, one doctor has discovered a large mass on her left ovary. Jennifer is sure that she has cancer.
I was dealing with this for so long that I figured if it is cancer, it's probably everywhere.
She knew very well what the survival rates of ovarian cancer were.
Jennifer is determined to find out, for better or worse, what the mass is. So her gynecologist refers her to gynecological surgeon Dr. Stephen McCarris.
She was really a mystery at first. Not only did she have debilitating, painful periods, but she also, as a married patient, couldn't even have relationships with her husband.
But along with these symptoms, Dr. McCarris also has an ovarian mass to consider.
With ovarian masses, we always worry about ovarian cancer.
Dr. McCarris begins running an exhaustive round of tests, including a special CA-125 blood test that will help him determine how likely it is that the growth is malignant.
Her CA-125 was 525 international units. 525. Normal is 0 to 35.
Suddenly, Jennifer's family must come to grips with the very real possibility that she may have cancer.
I think that she had always felt that there was a possibility, but this was the first time that it had actually had concrete numbers behind it.
She's my only child. Do you know what that did to our family? It was rough, really, really rough.
We both wanted kids. We both felt that this was something that could derail the adoption process that we had started.
The first thing that came to mind was, oh my God, we're probably going to have to stop this adoption and we won't have a family.
As Jennifer and her family struggle to come to terms with the likelihood of cancer, Dr. McCarris directs his attention to one thing: finding out exactly what's growing on Jennifer's ovary.
We needed a diagnosis at this point. We had an elevated CA-125 and an ovarian mass. The only way to rule cancer out is to get that tissue into the laboratory and have a pathologist give me a tissue diagnosis.
On October 5th, 2005, Jennifer is wheeled into surgery to have the mass removed and tested.
When I was in the waiting room, I paced up and down like a tiger in a cage.
I did feel that this was a turning point. You know, all the other doctors had given her, drugs or supplements or vitamins. This was a real intervention that I felt was really going to make everything better.
Back in the OR, Dr. Mackerras carefully explores Jennifer's lower abdomen laparoscopically, using a tiny camera on the end of a thin guide wire. And what he sees is shocking.
Both ovaries had masses that had grown and expanded to fill her entire pelvic cavity. And the ovaries, which are normally the size of a golf ball, had grown into the sizes of baseballs. I diagnosed Jennifer Bray with stage 4 endometriosis of her entire pelvic organs.
Endometriosis occurs when the tissue that lines the uterus grows outside of it, most often on the ovaries and other pelvic structures. During a normal menstrual cycle, this tissue breaks down and leaves the body through the vagina. But with endometriosis, the lining of the uterus recedes back into the pelvis, attaches to other organs, and grows. This results in internal bleeding and inflammation, and can cause extraordinary pain, infertility, and bowel and urinary bladder problems.
Jennifer Bray is in my top 10 list of patients with this disease.
In fact, Jennifer's endometriosis has invaded her entire pelvic region, including her ovaries, uterus, and fallopian tubes. The extent of the growth is so severe, Dr. Mackerras has no choice but to remove all of Jennifer's reproductive organs in order to prevent the endometriosis from attacking any other part of her body.
I think if Jennifer would have continued on the path she was taking, that she would have had major complications from this disease. Jennifer was very close to having rectal endometriosis. Rectal endometriosis then increases the morbidity associated with the disease.
After surgery, when Jennifer comes to, Dr. Mackerras explains to her the difficult decision he had to make.
Being only 34 and going through a hysterectomy, I guess would be hard for most people. I took it like a trooper, and I just figured I don't have to worry about periods, I don't have to worry about anything anymore.
Finally, after more than 20 years of living with this mysterious illness, the bizarre symptoms that were controlling Jennifer's life for so long begin to make sense.
The symptoms associated with endometriosis classically are painful periods, pain with intercourse, and irregular menses.
Dr. Mackerras explains that Jennifer's constant nausea was likely a result of the agony she was experiencing from the other symptoms.
Her presentation was pain. I'm nauseated, I can't eat, I'm losing weight, and I'm wasting away.
But while she presented many classic symptoms of the disease, the vertigo she experienced is a little trickier to understand.
The one unique fact about endometriosis, it can develop and affect any part of the human body. So I guess it's possible or conceivable that Jennifer had endometriosis of the inner ear. That's just a theory, but this disease is a very unbiased disease.
Finally securing a diagnosis after all these years is a watershed moment for Jennifer and her whole family. But they're not in the clear yet. She still needs to find out the results of the cancer pathology reports. After 3 days in the hospital, Jennifer returns home and waits for the call from Dr. Mackerras.
And I'll never forget when I was able to tell her she didn't have any cancer. The mystery was solved. Jennifer now could go on with her life.
Over the next 2 months, Jennifer rapidly returns to normal, a feeling she hasn't experienced since she was a little girl. Shortly afterward, she finishes what she and Michael started right before their last trip to the hospital.
In November of 2006, I traveled to China to meet and pick up our new daughter, Miranda Karis Martin Mei Lee Bray.
Jennifer is thrilled to have her life back, but can't help but wonder why so many doctors dismissed her symptoms over and over again. Endometriosis is one of the most common gynecological diseases, affecting more than 5.5 million women in North America alone.
This disease is likened the great imitator. And the patient gets turfed from this doctor to that doctor to this test to that test. So the next thing you know, the doctor has lost sight of the problem. The knee-jerk fix is give her a prescription for pain medicine.
On a warm spring day in 2003, Dr. Amy Lejeune finds herself unexpectedly rushing 23-year-old Marianne Piazza to the University of Alabama Hospital. She has just met her this afternoon and realizes that Marianne's life is in her hands when an X-ray reveals an unidentified mass the size of a football growing in her chest.
When she told me that there's something in your chest, it made sense that I'm not completely crazy. She was able to put the pieces together and to listen to me, and that's what no one had done for the past 3 years.
Now, the hospital staff is completely focused on confirming exactly what's developed in her chest. They immediately prep Marianne for exploratory surgery. It's imperative that they perform a biopsy to find out what they're dealing with. But all Marianne can think about is Mark, who is desperately trying to get to her side.
I was actually in Ohio, and that's probably the most helpless I've ever felt. Was having just these irrational thoughts of, is she gonna die before I get home?
Mark walks into the room just as they wheel Marianne in, along with Dr. Andres Ferrero, who has been assigned to her case.
Doctor came in and told her that we have a diagnosis.
Her diagnosis was what we call a Hodgkin's lymphoma.
Hodgkin's lymphoma is a common type of cancer that starts in the lymph nodes where infection-fighting white blood cells are stored. The lymphoma essentially breaks down these cells, interfering with their ability to do their job. This leaves the body vulnerable, making it possible for the cancer to spread and grow in the form of tumors.
The majority of the time we find the disease in a very early stage. And the problem is that by the time that she was admitted to the hospital, the tumor was about 25 centimeters by 15 centimeters in diameter. When you have this amount of tumor growing in your chest, then that can compromise your ability to breathe, and that's a very serious condition.
She got a little pout on her face, and then she started to smile. And the doctor says, do you understand?
I couldn't help but say, you have to understand that for all these years, that's all I've wanted, for someone to tell me what was wrong with me, and now you just have.
It was a tumor about roughly the size of a football in her chest, and it had compressed one of her lungs and actually physically moved her heart over. And of course, this explained all the shortness of breath, all the low energy, because, she wasn't getting all of her lung capacity.
In fact, nearly 75% of her lungs are completely obstructed. As for Marianne's other symptoms, 1 in 4 patients with Hodgkin's lymphoma will suffer weight loss, night sweats, and itchy skin.
I felt guilty because I feel like I should have known that there must have been something really wrong.
Inside, I was going, it's not fair. She is such a good person. Why is she having to go through all of this? She was so close to death. She has seen that door.
After she is diagnosed, Marianne is immediately transferred to the oncology ward, where Dr. Ferrero begins her treatments.
The good part about Hodgkin's lymphoma is that it's a disease that is extremely sensitive to the treatments that we have developed for that. And that includes chemotherapy, and that includes radiation therapy.
Chemotherapy is a regimen of toxic chemicals intravenously delivered to patients to destroy cancer cells. Used in combination with high doses of radiation, it can be extremely effective in treating some cancer patients. But the treatments require months of follow-up and can cause devastating side effects.
It was the sickest Marianne has ever been. And through all this, I was basically just trying to keep it together.
The multiple treatments shatter Marianne's fragile body, leaving her too weak to even speak.
Having Mark by my side kept me going. Because there were times when I wanted to give up. Since I wasn't talking, I still wanted to communicate with Mark. So I would always say, I love you. So I would just kind of motion to him.
That gave me more strength to deal with what was going on, because it was almost like her reassurance of, I'm in here still.
Finally, after 17 long months of painful recovery, Marianne is declared cancer-free.
When we heard that Marianne was in remission, it was like Christmas and your birthday all on the same day.
It felt like such a burden had been lifted off of me. I felt at peace, and I had not felt that way for years.
And after more than 3 years of waiting, on January 15th, 2005, Mark and Marianne finally get married. Today, 2 years later, they continue to live in their small town in Alabama. Her long recovery forced Marianne to give up her dreams of teaching, but she's settled into a job she loves at the local bank. Unfortunately, Marianne's cancer has come back twice since she was first diagnosed. It's a common occurrence of the late diagnosis.
We can cure a lot of patients with Hodgkin's lymphoma. But of course, your chances of being cured are much higher when you are diagnosed in a very early stage.
Nevertheless, Marianne considers herself fortunate that she was ever diagnosed at all.
When I think back to all the years of going to different doctors, I feel that I was ignored because I was so young.
It came across almost like it was like she was being written off.
One of the lessons that I have learned from Marianne's case is that if you treat a patient for some symptoms and the patient comes back to you with the same symptoms, you have to explore a little bit more and trying to find a different diagnosis.
I hope that more than anything that comes out of this, that people know that you have to keep going. Even if someone tells you you're fine, you're healthy, just to keep going and not to give up.
Today, Jennifer is a vibrant, healthy 35-year-old woman who is determined to put her past behind her and live for the future.
Jennifer has taught me that no matter how bad things get, if you work through the problems that you have, good things will happen for you in the end.
I think it's important to share your story because in my case, if I would have found someone years ago that had something similar to me, I could have been diagnosed earlier. Today, I feel like I do cartwheels. I'm just so happy and I've never felt better.